Thanks, Dr. Hart. All right. With that, again, I'm Nicole O'Malley with the Ochsner PR team. We've got the same spokespeople that you have gotten to know really, really well every single week. We've got Warner Thomas, our president and CEO, Dr. Robert Hart, our chief medical officer, Dr. Sandra Kemmerly, system medical director of hospital quality, and Dr. Catherine Baumgarten, medical director of infection control and prevention. So this is our weekly COVID update to keep you informed and answer questions that we're seeing and that you're getting from your viewers and readers. So at this point, I am going to turn it over to Warner.
Good morning, everybody. Thanks for joining us this week. We look forward to giving you an update and certainly tell you what's going on around the Ochsner system, and then we'll certainly take your questions and take the discussion where you'd like to go. So as of today, across the Ochsner system, we have 1,028 COVID patients across all of our campuses. That's a slight decrease down from last week where we had 1,043. So I wouldn't consider that a victory, but we are seeing some plateauing, especially in New Orleans. The 1,028, it's 77 in Baton Rouge, 112 in the Bayou, which is an increase from last week from 104. 355 in New Orleans, which is a decrease from last week from 382. 169 in Lafayette, which is an increase from last week. 106 in North Louisiana, which is the same, and then 209 on the North Shore. So we have seen a couple of areas like Lafayette and the Bayou increased slightly. We've seen New Orleans decrease slightly, and once again, North Louisiana stayed the same. 89% of our patients with COVID are unvaccinated. So we have 118 of those, 1,028 are vaccinated. All of the others, all the 910 are unvaccinated. Just give you a little bit of information there. When it comes to, we get asked a lot about the impact on other services. And this is absolutely impacting other services. Last week, we canceled 1,160 surgeries and procedures across our system. 1,160. So that is a significant disruption for other patients that we could not take care of because we did not have the necessary bed capacity, or we had to redeploy staff into other areas. On the redeployment, we now have 800 of our team members across the system that are redeployed. 160 of those are physicians that are redeployed. And then there's many, CRNAs, nurse practitioners, nurses from our clinics and surgery areas, as well as lots of other clinicians that are redeployed. So 800 redeployed across our entire system to be able to handle the ongoing complexity of patients from COVID-19 and the sheer numbers of patients that we've seen from COVID-19. We get asked a lot about the age distribution. It's been pretty much the same from last week. Average age of our COVID patient for this surge is 55. So that's down from the first surge where it was 69, and then in the early 60s for the second and third surge. We have seen, continued increase in pediatric patients. We've admitted in July, we had 7 pediatric patients admitted. We have 16 currently hospitalized across our system. And this is a significant increase from where we've been previously. So definitely concerned about what we're seeing there. Today, our quarantined employees who have tested positive for COVID and are being quarantined, 450. That's down from 530, about 10 days ago. So that's a positive thing. We're, seeing more of our employees come back. And on the vaccine front, we've now administered over 510,000 vaccines. As far as the Ochsner workforce, 62% of our workforce is now fully vaccinated. Almost 69% has gotten first doses. So, we have about 7% differential there of folks that are in the process and have gotten the first dose, waiting to get their second dose. Been asked a lot about third doses. We've administered 1,073 third doses to patients. We have 2,058 appointments for third doses that are upcoming, that we'll be giving shortly. So Robert, Sandy, Kathy, those are some of the, oh, and one thing, so on the staffing front, staffing is still absolutely an issue. In New Orleans, we did get some EMTs that were provided through, state resources and through FEMA. We also got federal staffing assistance in Lafayette, which has been very helpful. Professionals from the U.S. Navy, 4 physicians, 14 nurses, 2 respiratory therapists. And that's going to allow us to open up about another 16 to 18 beds, by Friday or by tomorrow. So we're excited to get that help. We're appreciative of getting that help, and we will continue to open up more beds. On the transfer front, so this is really, one of the real challenges out there, is that a lot of smaller facilities around the region transfer patients to Ochsner every day for a higher level of care. And it's normally about 50 a day. We've had to, let's see, we had about 150 requests last week that we could not take from 90 different facilities that we were not able to take because of, our capacity of COVID patients. These are things like GI bleeds, sepsis, fractures, kidney failure, heart failure, issues that patients need a higher level of care. And unfortunately, these patients are staying, where they are, and having to seek treatment there, which, frankly is very difficult, because many of these smaller facilities have trouble treating patients with these types of conditions. So that's an issue that's not talked a lot about, and how that's impacting patients, but it's impacting literally hundreds of people that can't get transferred to places like Ochsner or UMC or Our Lady of the Lake and other organizations like that. So it's a very significant issue. So with that, I'm going to stop. Robert, I don't know if you got, and I know we're going to hit a bunch of questions on vaccines and pediatrics and ivermectin and all those fun topics. So Robert, I don't know if you got things you want to add.
So yeah, I would add, as Warner, you went over the numbers across a lot of our regions and our total numbers, and the fact that they, if you look in total, we seem to have plateaued a little bit, been fairly stable. I think when you begin to dig to the next level, though, I think it's good to point out that now we're seeing more of those patients that are going into our ICUs. Earlier in this surge, they were coming into our medical surgical beds, just needing a little bit of support, either mainly oxygen, that sort of thing. Now, as this surge has continued to play out, more of those patients, even though our total numbers look the same, more of those patients are winding up in the ICU. The other trend that we see is, as more patients wind up in our ICU, more of those are having to be intubated and wind up on a ventilator. And I think, as we've all talked about, our whole treatment from the very beginning of the pandemic has changed, such that we do almost everything possible to keep from having to intubate patients and put them on a ventilator. And we are still doing that, but the fact that we're finding more and more patients winding up there indicates that now these patients, they come in and they are getting sicker. So we're seeing that, again, take its toll, because it, again, requires more resources, more nursing staff to take care of those patients in the ICU than it does on the floor. So I'll stop there.
Robert, the other thing I didn't mention, and maybe Sandy and Kathy can talk about the efficacy here, but the monoclonal antibodies, we've administered now, in New Orleans, Baton Rouge, North Shore, about 9,700 of these treatments. In Lafayette, they're doing about 300 to 400 a week there as well. And the results from this have been, excellent. For the 9,700 patients, only 28 of those have been admitted to the hospital after getting the monoclonal antibodies. So that's a really positive thing. But once again, the best thing is to get vaccinated and to not get COVID, where we see that the vaccine is very effective, given that we're not seeing a lot of vaccinated people be admitted to the hospital in comparison to the number of unvaccinated people, almost 9 times the difference. So,
right. I think certainly vaccinations are the best way to go. You mentioned, Warner, that we had gotten some help from some paramedics. That's actually where we've been able to use those paramedics, is in helping run our infusion suites. So we've actually been able to increase the number of patients that we're able to give the infusions to. And we had a large queue a few weeks ago of over 2,000 patients that we were trying to contact and get in. With the addition of the paramedics, it's allowed us to do almost another 100 a day. So we've been able to really work that queue down. And so now, if people qualify for the monoclonal antibody infusion, we're able to find a place and get them in within just a day or two. But that's, when you look at those numbers, the 28 out of over 9,000, it's less than 0.3%, 0.3%, less than that actually get the infusion that wind up having to be hospitalized. So it's a very good treatment. But again, vaccinations, let's get it on the front end so we're not even having to deal with the infections. So I'll stop there.
Yeah. The other thing I'd say, and this is state data, so you guys probably have this, but just to reemphasize it. So from January to June, there were 167 residents under the age of 50 who died from COVID. From January through June, 6 months. The first 2.5 weeks of August 1 to August 18th, 150. So, this, the Delta strain is, which I think, Sandy, you said is now like 98% of the cases we're seeing. Is that accurate?
It's almost 100%.
Yeah.
Clearly,
So,
way over 99%.
Yeah. So, this is impacting lots of people under the age of 50. It is no longer, something that's just impacting folks who are over age 60 or 70. It's impacting everybody. So I don't know. Kathy, Sandy, I don't know if you guys want to make comments, and we can just, Nicole, open up for questions.
Just to follow up a little bit about the monoclonal antibody discussion, to Dr. Hart's point, this is a passive immunotherapy that can prevent hospitalizations and death. It does not take the place of patients requiring vaccination after the fact. And so they'll have to be delayed 3 months after receipt of that monoclonal antibody. But it's absolutely not curative and it's not sustainable. So vaccination needs to occur after the monoclonal.
And Dr. Kimmerly and Dr. Baumgarten, we're seeing a lot of questions, particularly on social media, about ivermectin as a treatment option for COVID-19. So could y'all give a little bit of perspective there?
I mean, in short, Nicole, ivermectin doesn't work. This is a parasitic agent. It's become very popular in social media and amongst patients. It's used in veterinary medicine to treat worms and parasites, and occasionally in humans when a parasitic disease is diagnosed, but it absolutely has no place in the treatment of COVID-19.
Okay, thank you. With that, we're gonna.
Cool. I don't think we can stress that enough. The misinformation about this drug. It's total misinformation that's out there.
Yeah, it truly has, Warner, taken on a life of its own with COVID, which is baffling to a lot of people, but it certainly has taken on this sense that it's a viable option. But as Dr. Kimmerly pointed out, it just the studies, and there have been studies done when this first became talked about, looking at this, and it doesn't affect the disease. It doesn't have efficacy against COVID-19.
There is a
Great.
question in the chat, Nicole, I'll just hit quickly. Is there a challenge treating children in a facility that's not usually geared towards pediatrics? So at our Jefferson Highway campus, we have a children's hospital that's inside our main campus facility. Actually, #1 children's hospital ranked by U.S. News and World Report in the state. So we're very much geared to take care of kids, pediatric ICU, pediatric intensivist. So absolutely, we're geared to take care of folks here and have all those capabilities. Robert, I don't know if you got other comments on that, but.
Well, I thought that was a question for another hospital at first, but we take care of peds all the time. So certainly not a problem taking care of pediatric patients here.
Yep.
Okay, I'm going to go back up to the start with some questions. So Emily Woodruff asked, what advice would you offer to other hospitals across the country who are starting to see upticks in cases and hospitalizations based on your experience with this surge?
I think you've got to continue to hit the message hard around vaccinations. You've got to be, really clear about that message. I'd give them advice that you need to ramp your testing capabilities back up. So we had not seen a lot of testing, or as much testing in the previous months because we didn't have as many cases, but testing, became a major issue. And so we had to ramp our testing capabilities back up and drive-through testing and all those types of things, which you got to do at the same time that we're doing vaccines. Now we do a lot of vaccines at Ochsner. There's a lot of the hospitals that are not doing that. And then I think, really be communicating with your staff around redeployment and communicating with patients around the need to delay, procedures and surgeries and to redeploy staff in other areas. We had I believe it's yesterday, Nicole, that we closed the surgical hospital in Lafayette and had to cancel 200 surgical procedures to redeploy those staff into Lafayette General Medical Center. And these things are happening every day as we move staff around and are able to kind of cover the needs that we have. But having flexibility, ramping testing up, communicating with employees, getting them prepared to redeploy, increasing the speed of communication in your organization to be ready, because things definitely evolve. Being able to ramp up your emergency department. We've seen a tremendous increase in our emergency department visits in the past month. Sometimes 50 to 70% increase in volumes. So those are just some of the things. Robert, I don't know if you have others that you would add there, or Sandy or Kathy.
Yeah, I would just reinforce proactively looking down the road and seeing what PPE and supplies you're going to need as your needs advance, taking care of sicker people, all of the ICU needs that these patients have. And I do want to take a minute just to stress more the redeployment. I think the one thing that Ochsner and our employees have done just incredibly well across all of our campuses is really looking at the situation and going, how can I help? I mean, we've got over 150 doctors here at OMC, and I can't tell you how many across our other system have all stopped what they were doing in their everyday practice and said, where can I help? And they've gone into the hospitals to help. And we've got APPs who have done that. We've got procedural nurses who have come out of EP labs and endoscopy labs and signed on to help across in our units, in our intensive care units, everybody pitching in to help take care of these patients. And when you begin to get this onslaught of people, you need all these hands pitching in to help. And that makes a huge difference. But you got to be able to have these conversations about the work and the dedication to the community and the patients to take care of them.
And I would just want to add, we want to make sure that we support the staff as well. We have a lot of systems in place to support our staff and healthcare workers, and certainly want to give a shout out to them for everything they've done. But the other advice would be from an infection control standpoint about having the protective equipment in place, making sure that that's set up for people. And then also at our Jeff Highway campus, we opened 7 COVID units over the last 2 months. So having that infrastructure and personnel to continue to run those units, to be available in the ED, and to have all the equipment and personnel we need to take care of patients.
That's a lot of
with that, all right, Jeff Adelson with the Times-Picayune. I'm going to do question 1 and then question 2. So the first one, we've seen an increase in the raw number of younger patients in the statewide admission stats. Do you believe the increase in younger patients during this surge is simply a function of the fact that more people overall are being infected, or is there something different about how this wave is affecting younger people?
I can speak to that. I am concerned that the reason we're seeing younger people is that is also the segment of the population where we're seeing lower rates of vaccination. And so we know in our nursing home population that they are primarily and mostly vaccinated. There's also methods by which nursing home residents are tested. And so there's very proactive methods around testing and quarantine, and also proactive methods around masking. And so the concern is that in our younger population, they are not as highly vaccinated. And then the other thing that happens is they are probably more active, going out more, maybe not wearing their masks as much. So our message still is wear your mask, get vaccinated, and make sure you're protecting yourself and those around you.
Thanks, Dr. Baumgart. And the follow-up question, which you kind of touched on, was what would be the situation at your facilities if such a large portion of the elderly population was not already vaccinated, which seems to be helping keep them out of the hospital?
So the situation would be worse. I mean, we would see more people in the hospital and larger numbers of people in the hospital. Thank goodness we're not seeing that as much in our elderly population. Now, the elderly population is still vulnerable, and so it's still important to wear a mask, because we know that in those that are vaccinated, sometimes the elderly population may not mount as good of an immune response. So we want to make sure to protect them. And so that's why we talk about other mitigation efforts, such as wearing a mask, making sure if they are going out that they're taking proper precautions. And then for those that are visiting and around elderly patients, to make sure that they're also wearing a mask and vaccinated. So all of these measures, the same ones that we've used before, play into protecting the elderly. It also plays a role in protecting our kids, because we know with this surge, we've seen a higher proportion of children with active disease as well. And so those that are ages 0 to 12 can't get a vaccine. So those of us that can should continue to be vaccinated to protect that population as well.
I would just say that, the situation we're in today, and I mean, once again, we canceled 1,160 procedures and surgeries last week to redeploy staff. So if we did not have the higher vaccination rate in the elderly population, this would be extremely worse than where we are today. There's no doubt about it. It's a very challenging situation today. We're working through it, but let's be clear. The healthcare workers that are out there getting this done are superheroes at this point, given what they've been through in the past 18 months. And as Dr. Hart said, physicians and other clinicians saying, look, how can I help? Where do you need me? What they're doing to take care of this, continued surge has been exhausting and challenging, but they're doing it and they're getting it done and they're doing a great job. So yeah, it would be significantly worse if we did not have the elderly with such a high vaccine rate. And you know, we're fortunate that we do have a high vaccine rate there. I wish we'd have that in other age demographics as well. If we did, we wouldn't be in this situation. There's no doubt about it. If we had a higher vaccine rate, we would not be in this situation.
Okay, I saw a question, and I think we did, Warner, you did touch on this in our last briefing, kind of some of our internal modeling and looking at projections of this current surge. Do we have any new info available on that about when we may plateau with this surge?
So in New Orleans, we think we are at a, you know, we're at a plateau. We are not continuing to escalate. You know, the R0 has come down some. We think the masking has helped. I see a comment in here about, you know, should there be more done? I think the masking is a great move by the governor. We just need people to adhere to it and do it, and to wear the mask, and to do it across the state, not just do it in certain areas. I think the other thing is we need people to get vaccinated. So, I mean, I think those are the things that need to take place so that we can go on and continue to have, you know, live our lives the way we all want to live them. So with that being said, you know, I think in New Orleans, we're starting to see, you know, a slight decrease. Lafayette is, you know, continuing a slight increase. We think that North Shore, I believe, Robert, North Shore, we're seeing some plateauing on the North Shore in the modeling as well. So yes, but you know, let's not declare victory here. Let's stay on this. Let's keep masking. Let's keep getting vaccinated, and let's keep being safe. So that's what's got to be done, is people have to adhere to the you know, procedures that are put in place to protect people.
Yeah, I might add a little bit more there, and Warner's right. We saw a little dip about a week ago here, and we were hopeful that looked like things were going to continue to drop, and then they just seemed to plateau. And that's when you look across our system, you see kind of almost just level for the past several days. But Lafayette continues to have high numbers. Baton Rouge continues to have high numbers. So we're still watching those very closely. The question about what do we predict, or do we think that's going to just continue to come down? The real wild card here is going back to schools reopening. And one of the things that we've not had thus far in the 3 different surges is this situation where we're kind of at the peak of a surge and then the schools open. So you've got an opportunity for a lot more interaction with people. And so we don't know how, and with this Delta variant, as has been touched on earlier, how it's affected younger people and certainly the pediatric population. We don't know how that's going to affect this surge. So it's a little bit, we really can't use the previous 3 surges to make a prediction here, because I think this throws a variable in there that we're not used to dealing with. I do want to say, though, this highlights how important it is for children going back to school. They need to be wearing a mask. I know there's a lot of debate about it, but it is very important. If we're going to pull these children together, and we know they need to be in school learning for a lot of reasons, education, social development, psychological development, they need to be wearing masks. That's the only way we can do it safely. Otherwise, we're going to be shutting down and going to virtual schools again in a matter of weeks to months. So very important for the children to be wearing masks.
And I think it's safe to say, Robert, the virtual experiment from last year was a failure. It did not work well.
Yeah, all of the information data we're looking at, there's been a decline in the educational progress that many of our patients' children have made really across the country. Certainly here, doesn't look like it's been as effective as we would like. And again, the other important thing about schools is the psychological and social development that children get. And when you take them out of that environment, it is a tough situation. And so important for the schools to be back in session and educating our children.
Hey, Dr. Hart, we got a question. What kinds of surgeries are being canceled? Can you help illustrate why it's a big deal to cancel 1,100 surgeries in a week?
Yeah, so these could be anything from a cancer staging type surgery where you're trying to assess what type of care going forward might need to be done for a patient. These could be people that need cardiac surgery, not emergently, but certainly on a semi-urgent basis so that they can continue getting out of perhaps a somewhat precarious position with their health. These could be things like transplants. We've had some transplants that some living donor transplants that we've had to put off to be able to do them when we had more bed availability and resources to care for them. And so let's take a kidney patient who's waiting for a transplant. That patient now has to continue on dialysis for a while. And dialysis has some inherent medical complications associated with it that the sooner that patient can get a transplant, the better off they presumably will be. And so when you begin to have to put these things off, care is affected for lots of individuals. And so it's unfortunate, but we've got to make sure that we are in the best position possible to take care of them if we're going to do those surgeries. And right now, we are very busy taking care of the COVID patients.
And just as an aside, I mean, at Ochsner Medical Center, we're one of the largest transplant centers in the country. So, the demand on resources from that transplant program is huge. And as Robert indicated, some of those are planned given the types of transplants they are, and those are not able to be done at this point in time.
Callie does a question if we're doing monoclonal antibodies as a treatment for COVID. So I know we touched on this before, that we are doing this as a treatment for COVID across the state. But I don't know if Dr. Hart or Kimberly or Dr. Baumgarten, if y'all just want to touch on that one more time, since we know it is a very effective treatment.
So yeah, just to reiterate, so we are using the monoclonal therapies in the outpatient settings. We're using the Regeneron product, and the idea is to give people passive immunity at the time they're initially infected. We want to give it early, within the first 3 to 4 days of becoming sick from COVID, but it is not a substitution for vaccination. And we're recommending that people get vaccinated 90 days after the monoclonal infusion, but it does decrease the numbers of hospitalizations following having acute COVID.
Okay. And Emily Woodruff asked if we've seen any differences in our Mississippi facilities as compared to Louisiana.
I think we see the same escalation in Mississippi. I mean, you guys have, seen the same news reports we've seen, that they're opening field hospitals in Jackson. So the escalation in Mississippi is significant as well. We have a smaller presence in Mississippi compared to Louisiana, but I would say we definitely continue to see escalation there as well.
Okay, we do have a few minutes left. So if there's anyone that has a question and wants to come off mute, you can do that now. Oh, Blake.
Hey there. Yeah, I was wondering, so on that question about mitigation measures, so do you think the mask mandate is enough, or would you recommend capacity limits or other mitigation measures?
I think we're leaving those decisions to the governor and to the Secretary of Health and to Dr. Cantor. We'll follow their guidance. They have a broader view of kind of what they're seeing. They look at what's happening in the hospitals and, kind of look at the public policy and public health issues. So we support, the direction they take. I would say, the more people adhering to the mask mandate would make it more effective. So we'd like to see more consistency from the general population in masking. And we'd like to make sure, as Dr. Hart said, that kids are masking in schools. We think that's important as schools continue to reopen.
Okay, it doesn't look like we have any other questions.
Can I ask another question?
Oh, sure, Blake.
You said you're seeing a plateau. You don't want to declare victory, obviously, but you're seeing a plateau in New Orleans. Is that a plateau in, I guess, hospitalizations? And I guess a secondary question is, do you think that's because of the mitigation measures that have been put in place in New Orleans?
I'll let Robert and Cindy and Kathy kind of hit that.
So, yeah, Blake, I think when you look at the timing of the mask mandate and you look at the rate that our cases were going up, I have to believe that, and again, we saw this with some of the other surges as we began to take mitigation measures, but I believe it was about 10 to 14 days that we at least began to see things begin to level out. Now, we've talked about a plateau, very happy to see that, but I agree, we're not going to claim victory over that. We need to see those coming down. But certainly the continued rise that we were seeing prior to that has not continued. So I think the mask mandate, I think, has made a difference.
Okay, final call for questions, and then I'll let our spokespeople, if there are any final comments y'all want to make based off of the questions and conversation today. Oh, another question just came in the chat. Will you make monoclonal antibodies available to anyone?
So there are some criteria for appropriateness of use. And so our physicians and providers can refer for people to be treated with the monoclonals. Not everyone that tests, not every perfectly healthy 18 to 20 some odd year old actually is at risk for more severe disease, but if it's appropriate to be treated, we will treat them with the monoclonal.
I have one more question here. I just wanted to ask, this is Blake again with the Advocate. I just want to ask, we're seeing some misinformation coming from physicians and nurses. The Federation of State Medical Boards released a statement saying that they would or they think that doctors who spread misinformation should, be disciplined. Dr. Hart or anyone else, do you all think that the Louisiana State Board of Medical Examiners should take a similar approach to combating misinformation among licensed physicians? So,
yes, I think if a complaint is lodged with a LSBME, my understanding is that they will investigate it and look into it and see what the appropriate action ought to be. But my understanding in my conversations is they certainly support the position that's been taken around physicians spreading misinformation.
All right. Warner, Dr. Hart, Dr. Kimberly, Dr. Baumgarten, any final words you think we should leave everyone with today?
You guys have anything you want to add?
I mean, I would just like to add that we are continuing to vaccinate people in Louisiana, and fortunately, we have seen an uptick in our vaccinations. We've given over 500,000 vaccinations through Ochsner's efforts alone, which is great. Just on Tuesday, we partnered with the Saints, and had an event and gave about 2,000 vaccines across Louisiana and Mississippi. So we're thrilled to see that uptick in vaccines, and we need to keep pushing that, and would really appreciate your help in the media front to continue to promote these events and promote positivity around vaccination. We're using lots of methods, from having vaccinations readily available to encouraging our clinicians to talk about vaccinations with their patients, because we know that patients trust their clinicians and physicians. So we have lots of physicians that are talking about vaccines that might not normally do that. We have neurosurgeons that are talking about vaccines with patients. I was speaking with one of our dermatologists yesterday who's talking about vaccines with her patients. So we have clinicians across our system that are reaching out to patients and trying to encourage this. It's also important that we talk to people that have gotten vaccines to make sure that if they know they have a family member or loved one that's a little reluctant, that they speak up and talk about their experience, and maybe if they were a little bit on the fence or a little bit concerned or scared, what prompted them to change their mind, and then also their experience with getting the vaccines. Because we still know that as many patients as we have in the hospital right now, we don't have any patients in the hospital with vaccination side effects. And certainly there are minor side effects with the vaccines, we understand that, but at the same time, it's just a simple way to protect those around you, especially since, as we talked about earlier, we're seeing these populations such as children that can't get vaccinated with increased risk. And then also we know that in our elderly populations where the vaccination rates are high, that we're not seeing them as much come into our facilities. So we just want to continue to spread that word and that news.
Kathy, can you comment on just the increase that we're seeing with pregnant women with COVID, and kind of what's the situation there? Because I know there's been a lot of misinformation there as well. So let's just get an update there.
Happy to. So we continue. We do these forums with our physicians. We do a lot of outreach with the community in terms of trying to work with businesses, with schools. We do WebExes. We have all of these sessions with our community to try to talk through what happens with vaccines and some of those misinformation that's out there. And we continue to get the question about fertility at each and every session, I think, that we do. And this started as misinformation, a misunderstanding about cross-reactivity with proteins, and was very quickly dispelled. I mean, that was proven incorrect, that there's no cross-reactivity, that information that it first started was not valid, not true. And there have been now studies in multiple societies that have come out in favor of getting the vaccine in pregnancy, and also debunked the misinformation and the myths that this affects fertility in the future. We know that the American College of Obstetrics and Gynecology is in favor of the vaccine. The CDC supports the vaccine in pregnancy. The American Society of Reproductive Medicine is in favor of the vaccine, is support of the vaccine. So all of the major societies that are proactively for the health of women and proactively looking out for the health of women are in support of vaccines in pregnancy and for young women. And, this is a consideration I've talked about with you guys before. I have 2 young daughters, and both of them have gotten vaccinated. And I've talked to both of them to see if they have these concerns, and they told me no. And I don't have that concern, or I would not have given the vaccine to them. They've done their research, they've looked online, they've talked with friends, colleagues, they've looked at valid websites to see what they think, and have decided to get the vaccine themselves, and did so. So still an important topic, but we need to continue to dispel these myths.
And the challenge we see is we keep seeing more pregnant women getting admitted with COVID, and the negative impact that having COVID as a pregnant woman can have on the baby is something that people are not talking a lot about, and it's a significant issue.
We've seen more pregnant women have to be in our ICUs too. We've had pregnant women in our ICUs. We've heard about deaths in pregnant women, and that's devastating. And we know that we can prevent that. This is preventable through vaccination. The other piece of it is we know that once the baby is delivered, if the mom has gotten vaccinated, there's protection to that baby too. And that baby can't get vaccinated at this point in time. So that protection is conferred from mom to baby as well.
Thank you.
I would just wrap up with vaccinate, wear a mask, take care, keep yourself healthy and those around you. But keep in mind the decisions that you're making about vaccinating are not just an individual decision. You are affecting the care of people around you and around this state because it keeps other people from not getting care that's needed. Thank you.
Well said. I have no
All
other
right,
comments.
everybody. All right. Thanks, everyone. We hope you have a good rest of the day.